I'm going to present my work, which is looking at detecting precancerous and cancerous lesions in patients who've got a specific inflammatory condition of their large bowel called ulcerative colitis, which is a fairly common problem. In the UK, for instance, and I'm sure in the US as well, about 4 in 1,000 people have this condition. The risk of developing cancer in this group of patients is about 2 to 3-fold higher than the normal population. So it's important to try and pick this up early enough so that we can try and prevent the cancer from developing, or if it does develop, treat it early so that prognosis is better. This study really looked at 2 different modalities of surveying these patients. One was using the latest generation high definition endoscopes, which would be very similar to the high definition televisions that are probably in use now. So these have 1 million pixels in the screen, so it improves the resolution of the image. Now, studies that we've done earlier have shown that if you used high definition scopes, that improved your detection yield with older generation, standard definition as we call them, which only have about 250,000 pixel densities on the screen, so resolution is not as good. But there are studies which improve the contrast of the image on top of the resolution, which is called Chromoendoscopy. This involves spraying a dye, which is a food colorant really. So the dye we use is called indigo carmine, which is blue. There are other dyes in use as well, one of which is called methylene blue. So I personally think there's little to choose between them, it's just the color. But we used indigo carmine because it's licensed for use in the United Kingdom and it's safe. So we sprayed this dye. So there have been studies which have looked at the older generation scopes and have shown that if you sprayed this dye, then you detected more dysplasia or more precancerous lesions if you sprayed the dye than if you didn't spray the dye. And we showed that in a study which pooled all these studies together, which we call a meta-analysis. So we published a meta-analysis a couple of years ago, which showed that if you sprayed the dye in about 14 or 15 patients, you detect 1 extra patient with a precancerous lesion, which is only a good thing. And the problem is that it increases the time it takes to do the procedure. The dye can be a little bit messy. Now we found that if we use the high definition cameras, about 1 in 10 patients have a precancerous lesion detected, which is very similar to the study we did earlier where we used high definition cameras and compared them to standard definition. 1 in 10 was the number we found in the high definition group in that study as well. So very similar rates. But surprisingly, well, I wouldn't say surprisingly, we anticipated that this was likely to happen. When we sprayed the dye on top of using a high definition camera, we detected 20% of patients, or 22% of patients in that group really had a precancerous lesion detected. So about 2-fold increase in the detection rates of precancerous lesions in this group of patients. That seems to suggest that if you use a high definition camera with dye spraying, would probably be the best modality to survey for colon cancer in this group of patients. No different. There are 2, the concentration of dyes used in several studies have varied a little bit, but it doesn't matter. I mean, I would say use a dye concentration and a method that you're comfortable with. At the moment, all the studies, despite what concentrations I've used, have all uniformly showed that the detection rate improves when you spray. So it's the same dye. We didn't change the dye and the concentrations of the amounts for this study.